Hey there, VCE HHD students. My name's Andy. I'm a VC Health and Human Development teacher. In this short video, we're looking at direct, indirect, and intangible costs to individuals and/or communities, and this is part of Unit 1, Area Study 2 for the 2025 plus HHD study design. If you haven't already and you're on our YouTube channel, you can subscribe with the button in the bottom corner of the video there, and that means you'll get alerts to all of our new videos coming out across the year. We've also got our website, thehrh.net.au, where there's opportunities for students and teachers, and that's being updated regularly, so please check that out. You can see we've got our Instagram, TikTok, and Facebook pages where you can follow us and get alerts to our new videos, as well as other opportunities in SAC and exam tips and advice, and also our email, info@thehrh.net.au, where you can get in touch. Okay, so what parts of the course does this particular video relate to? So you can see there some Unit 1 key knowledge and key skill points from the study design. And so you can see that the key knowledge mentions the following features of one health focus relating to Australia's youth. So in class, you might be looking at a particular health focus, such as mental ill health or something else, okay, that's a focus for Australia's youth. And you can see there's a range of different examples that you need to be able to link into that particular health focus. And the one that's bolded is direct, indirect, and intangible costs to individuals and/or communities. So that's what we're focusing on today. And so the information that we're going to touch on today, not only does that need to be able to be applied to your particular health focus, but when it comes to assessments or an end of year exam, you could be asked about a condition that maybe is not the one that you've focused on in class. So you need to be able to understand this information in a way that you can sort of apply it. So that's really common, I guess, across Unit 1, 2, and particularly into Unit 3, 4 for HHD, that being able to apply the information you've learned is really vital. So we'll have a look at how to do that today. And you can see the Unit 1 key skill is related to this key knowledge point. So first of all, what are direct, indirect, and intangible costs, and what is individuals and communities? And we'll touch on that in a moment. So direct costs are those that are related to preventing the disease or condition and diagnosing, treating, and managing those with the disease or condition. And these are typically relatively easy to put monetary value on. So both prevention and diagnosis, treatment and management or cure of a condition is what this is related to. And so we'll look at some examples that are relevant to this for both individuals and having to sort of pay out of their own pocket, but then also cost to the community. Then indirect costs are not directly related to diagnosis or treatment of disease, but they do occur as a result of the person having the disease. And so you can see some examples there: work absenteeism costs, government welfare payments that might result, okay, from somebody having a disease or a condition. And so once again, okay, these are sort of somewhat easy to put a monetary sort of value on, but that's then different to the last one. Sort of intangible costs are difficult to put a monetary value on, and they include things like pain and suffering, worry and stress about the impact of a condition, or loss of self-esteem as a result of having a condition. So that term intangible often sort of relates to not being easy to perhaps see something. So sometimes it can be difficult to see if someone's experiencing pain and suffering, or they're worried and stressed about something. So they're more difficult than to put a monetary value on, but we'll also look at some examples of this. So as it says in that last point there, you're required to consider direct, indirect, and intangible costs for both individuals and the community. So obviously individuals is about sort of an individual person, okay, and how these costs are related to them. When it comes to the community, that can be related to sort of a range of different things in the community. So it might be to do with sort of workplaces in the community or particular groups within the community, but also things like the government, okay, and the tax that it might collect from individuals in the community, and then the costs associated, okay, with using that tax, because that obviously overall has an impact on the community in different ways. So that's what it means when it comes to individuals and the community. And so we'll obviously look at some examples that relate to both of those. So firstly, for direct costs, if we're looking at individuals, you can see that the first example is payment of fees associated with seeing a health professional for treatment. So that would include a GP, a psychologist, or a counselor, depending on the condition. So if an individual has to pay, okay, out of their pocket, okay, some money associated with seeing that health professional, then that would be an individual direct cost. The second one, payments associated with medication required to treat or prevent conditions. So once again, that would be money out of an individual's pocket, okay, directly related to the condition. And then payments associated with private health insurance premiums that might be taken out to access private hospitals or professionals for treatment. So once again, individuals might have to pay directly for that. In terms of the community, costs associated with government subsidized healthcare, such as GP schedule fees and public treatment costs. So this would be things like government taxpayer money, okay, that might go toward Medicare to do with seeing a GP and public hospitals, okay, so that individuals in the community can participate in that for treatment of a health condition. And so this cost is sort of borne by the community because it comes from taxpayer dollars. The next one, costs associated with subsidizing medications listed on the Pharmaceutical Benefit Scheme or the PBS to prevent or treat conditions. Once again, because this is from sort of taxpayer money, it's borne by the community. And then costs associated with government-funded health promotion programs. So these could be health promotion programs that might be to do with preventing things like smoking and vaping or encouraging people to be more active in their day-to-day life. And so if that's a government-funded health promotion program, once again, through taxpayer dollars, that's borne by the community. So you can kind of see a bit of a theme there with those community direct costs, that they're all sort of linked into sort of taxpayer dollars associated with the government. So that's a good, I guess, thing to fall back on when it comes to some of these direct costs in relation to the community. And so, as I said earlier, you need to be able to sort of apply these to specific health conditions if you're given a specific health condition, okay, and asked to link these in. So obviously that just means, for example, if the condition was perhaps mental ill health, that when you're talking about these, you would just insert that as an example. So for the first individual direct cost, you might say payments of fees associated with seeing a health professional, such as a GP, to treat mental ill health. So it's not that difficult to apply them. You're just sort of making that health condition then relevant, okay, to that particular example. So then some indirect costs. So once again, remember these aren't necessary to do with sort of that treatment or management of the condition, but they do come about as a result of individuals having a condition. So the first individual one there is costs associated with transport to and from appointments with health professionals that are required for managing and treating health conditions. So if you're having to pay for public transport or for a taxi or something like that, it's still a cost, okay, that you're directly having to pay for, but it's not associated with treating or managing the condition. It's just about getting to or from that health professional. So it's an indirect cost. You're still having to pay something, but it's not directly related to treating and managing the condition. Next one there, costs associated with lost income as a result of not being able to work from a health condition. Okay, so as you can see, it's still to do with having the health condition, but it's not directly related, okay, to treating and managing it. Okay, it's an indirect cost. It's got to do with losing income if you're not able to attend work due to the health condition. And then the last one, costs associated with education or training or upskilling required to gain new employment if you're no longer able to continue previous employment as a result of a health condition. In terms of community costs, you can see there lost productivity to a business who may lose employees who can no longer work as a result of, okay, ill health. So a person has a health condition and then the business, okay, is not as productive as those employees aren't able to work or not as productive in the workplace, and that's a community cost. Loss of government tax revenue if people aren't working as a result of ill health. So once again, that's an indirect cost because it's not to do with managing or treating it, but the government's losing tax revenue if people aren't able to work as a result of the health condition. And then welfare payments for a family member who may need to become a carer to support a person with ill health. So these are all indirect community costs. Intangible costs, so as we said before, okay, these are a bit more difficult to put monetary value on. So you can see there for individuals, the increased feeling of perhaps worthlessness that they might experience if they have a particular health condition, okay, a reduction in social participation if ill health prevents an individual from partaking in social activities. So that's an intangible impact on the individual if they're not engaging with others in the community. And then the stress and concern that may result from someone who has ill health worrying about their future and if they will improve. So as we said sort of earlier, these are sort of sometimes more difficult to sort of see, okay? They're more intangible, okay? Harder to sort of put your finger on, but they are still sort of impacting individuals. And then the community, so the grief and suffering that family and friends might experience as they observe a loved one struggling with the consequences of ill health or a health condition, and the reduced opportunity for social interactions and engagement for family and friends as a result of their loved one not attending social events due to ill health. So this is more about sort of those individuals within the community that are associated with that person with ill health or the health condition and how it can have an impact on them as well. So these intangible costs for the community as a result of that health condition. Okay, so what might a sample question and sample answer look like? So this one is saying or asking you in your response to outline a direct cost for asthma for both individuals and the community. So you can see there the things to look out for. It's talking about a direct cost and then a particular condition, so asthma, and asking that to be linked to both individuals and the community. So you can see there a sample answer for individuals. It might be payment of fees associated with seeing a GP for treatment for asthma. So you can see there you're obviously linking in something specific for an individual. So those fees associated with seeing the GP, and then you're making it relevant because you're including asthma as part of your answer. And then for a community, costs associated with government-funded health promotion programs for asthma. So as we said earlier, that's a direct cost to the community because taxpayer dollars have to go towards those health promotion programs for asthma, and they can often be associated with educating people to help treat that condition. Okay, hopefully you found that video useful. You might like to let your Unit 3 for HHD student friends know that there's a revision question book here with practice SAC and exam questions for any Unit 3 for students that are interested, and that's at book.acevce.com. And as I said earlier, you can always head to our website, thehrh.net.au, to see other opportunities and things that are going on. Thanks so much.